Dr. Hogan.
I'm Jamie.
This is Jamie. Jamie, what's your position here?
I am a technician here, not a registered technician yet.
Not yet.
Not yet.
Soon.
I take my test on March 24th.
Yay!
So it's very exciting. I'm very nervous, but it's going to be fine.
It's going to be fine.
Yeah.
You've been
Whatever
learning a
happens.
ton. It's
Yeah.
okay. It's going to be fine. It's stressful, though.
Yes.
Those-
I'm very stressed.
Those big
But it's
tests
fine.
are scary.
Yes.
But, so Jamie just graduated from school. You graduated in when?
November from Midwest Institute.
So, yeah. So
So-
she's brand new.
Yes.
She's brand new.
This
So
is
what
my
do you...
first clinic.
Is this your first clinic?
Yes.
Yeah, not your first job, but
Right.
first
My
clinic.
first clinic.
Yeah.
Yes, I love it.
Yeah, it's good.
great. Yes.
Good. So what's been your favorite thing to learn about so far?
Oh gosh. I like to learn about the clients.
Yeah.
I like meeting the new clients, building relationships with them.
Mm-hmm.
And then I love learning blood draws.
Yeah.
Getting better at those every day. So that's great.
That's good.
Yes.
Yes. It always just takes practice. It takes-
Microscopes.
Oh,
Looking
yeah.
at the slides.
Mhm.
Love doing that.
Mm-hmm. Yeah. Anything else?
That's radiographs.
Yeah.
Doing those. Doing more of those now.
Mm-hmm.
It's great.
Yeah.
Yeah.
So it's good for you to learn.
Yes.
It's good practice. And it's just that's all it is. And
Yes.
just seeing things repetitively, you learn.
Yes.
You learn as you go. So yeah, Jamie's awesome. She's really great with clients. Her communication skills are fantastic. We love having her here for sure. Thanks, Crystal, for joining from the other room. But also, Jamie has a side hustle
I do.
that we're going to talk a little bit about today, because I think it's pet sitting month, maybe, or week, or
Oh, this is
something. I
perfect.
forgot to look. But yeah, Jamie does pet sitting.
I do. I love
Yeah.
pet sitting.
So tell us a little bit about what you do for pet sitting.
I usually stay at people's houses when I do it. I watch a patient, well, not a patient, a person that I pet sit for. He has diabetes, so I can give the insulin, things like that. If you have medications I need to give
Yeah.
them, totally fine. I don't mind doing that at all.
Mm-hmm.
I usually stay at the house. They show me the routine, and it's not that big of a deal. So just let me know if anyone ever needs a pet sitter. It's great. Extra money.
Yeah.
So
It's nice. It's a nice alternative
Yes.
because not all animals are thrilled about going to a boarding
Yes.
facility. The boarding facilities are fantastic. They take great care of them, but
it can be stressful.
it can be stressful. You know, I have a couple dogs at home that they don't kennel well. They just don't. They
Yes.
freak out
My
in the
dogs
kennel.
are freaks.
So they can't. So with that, when I go out of town, when myself and my husband go out of town together, we typically will hire a pet sitter. So it comes to our house. Of course, there's also people that pet sit in their own homes.
Correct.
That's another option. So it's important to ask those questions. If you're looking to hire a pet sitter, find out what their expectations are, communicate what your expectations are. Are they just doing pop-in visits? Are they staying at your house? Because you basically just
I
stay at the
stay.
house as though you
Yes.
live there.
Yes, 'cause I
Mhm.
still live at home.
Right.
So I think that's kind of putting a burden on my parents
Mhm.
too. So if I lived on my own,
Yeah.
then yeah, I would definitely have them stay at my house if that would be easier for them.
Mhm.
But usually it's just easy for me to go there.
Yeah.
And it's less stressful to have to take them to another house. So
Right. Yeah. And I prefer to have people come to my house
Yes.
just because then my dogs, because they're spoiled rotten,
Mine are too.
just so they don't have, they don't have to move outside of their comfort
Mhm.
zone. I don't have to worry about arranging pickup and drop off.
Yes.
Which is nice because a lot of times I get back like late on a Sunday, and so not having to make somebody be at home at a certain time,
Mhm.
that's nice. They can just be there in the morning, take care of them in the morning, leave as though they're going to work, just like I do,
Yes.
and then I come home later that night, and it's great.
It's nice.
So I definitely prefer pet sitters for my own crew. There's also some benefits to it health wise, not just from, like Jamie said, she can do medications and things like insulin and that. It's a little bit closer monitoring because it's a little bit more of like a one-on-one
Yes.
type deal. So that's nice. But also from the standpoint of, just anytime that you get a lot of animals in one location, you're going to be more prone to things like kennel cough.
Yes.
Even if your pet is vaccinated against kennel cough, there's at least a dozen things that cause it,
Mhm.
viruses and bacteria. We can only vaccinate against a few of them. So even if they've had the vaccine, they can still get kennel cough. So it's something, trying to avoid that. If you have somebody that's elderly or already has maybe immune system problems or something along those lines, it might be nice to have somebody come to your house or you take your pet to their house so that you lessen that risk.
Yes.
for sure.
Definitely.
You know, kennel cough's not generally a big deal. We do some antibiotics. They're usually good within a week. But again, elderly, or if they're already sick from something else, they're more likely to have more serious issues from that. So I think that's an important thing to keep in mind as well.
And mostly not always, but most of the time I pet sit for elderly dogs too.
Yeah.
And they love having someone just come to their house.
Yeah.
It's a lot easier for them.
Yeah.
Too, because they know their routine.
Exactly.
If they go somewhere else, they're bored somewhere else, they're completely out of their routine. They don't know what's going on, and it stresses them out.
It does. Yes, it does. And then you get stress diarrhea, which is also awesome.
Yes.
So what questions do you typically ask people before you go pet sit at their house?
I ask how they go outside, because I watched one family, they let their dogs out through the front door and then they come out through the back. They come inside through the back.
Okay.
So I ask if they have a yard, if they have an electric fence, what medications they're on. If they are on medications, that's usually one of the first questions I ask too.
Okay.
So how much food did they get? Did they get fed once a day, twice a day? Do they just have their food out? Things like that.
Yeah.
So where is their food? Where's their water? Do they have to be kenneled up?
Yes.
So,
yeah. All good questions.
Definitely.
That's excellent. Because trying to keep it as consistent as possible.
Yes.
From how they are normally, you know, when their family's home, you know, what's their normal routine.
Yeah.
Keeping that the same, I think, is very important, especially if they're on any medications.
Right.
Making sure that it's timed correctly.
Right.
You know how they take their medications.
Yes.
You know, can you trick them and just put it in a little bit of peanut butter or cheese or a pill pocket, or are you having to like pill that you know, before you're trying to wrestle with them and that. Yeah.
And like, how are they around other people they don't know?
Yeah.
Because sometimes I'm meeting them for the first time.
Sure.
So I need to know if they're going to be comfortable around me or not.
Yes.
So.
Yeah. Are they going to freak out when you come in the house and nobody else is home?
Yeah.
So, you don't want bad things to happen there. That would not be good. But yeah, it is good to set up a meet and greet first for sure. So at least that's not, you know, they're not walking to the house, nobody else is home.
Definitely.
And that's the first time that animal's ever seen you. That's not good.
Yeah.
That's scary.
I've never experienced that before, but I prefer a meet and greet before I pet sit for them to make sure it will work out.
Yeah.
So
I think that's smart.
Yes.
I think that's very smart.
Thank you.
Yeah. There's all kinds of information out there. You can find people on the internet. Rover.com is one place that I've gone before to find pet sitters when I didn't know anybody personally, or the people that I knew personally weren't available for whatever reason. I've gone on rover.com. There's all kinds of great pet sitters there that you can, you know, kind of chat with and interview with. Also, if you go through that website, I think that there's some kind of like insurance sort of thing that if something was to happen, some kind of accident or something like that, I think that they help cover some of the cost, which is fantastic too. That's good peace of mind for the pet sitter and for the client.
Definitely.
Yeah.
Yes.
It's great. So what else do you like to do in your spare time?
Oh gosh. I love bargain shopping.
Nice.
TJ Maxx is my place.
Yes.
Target. Gotta love Target.
Yes.
And then I love doing hair and makeup on the side too.
Yeah.
That's a lot of fun.
Yeah.
I've done all of the other coworkers' makeup here before. So that's a lot of fun. I love doing it.
It is. She does a great job too.
Thank you.
It's very pretty.
Thank you.
Yeah.
So yeah, that's about it. I walk my dog now.
Your dog. He's here today.
He is. He needs a nail trim.
So what kind of trouble has he gotten into lately? What's the most recent thing?
He ate his harness for the third time. I had to buy him a harness for the third time.
Oh no.
He ate my glasses. I had to get new glasses. He ate my curling wand, my dry shampoo, my favorite pair of boots.
Yes.
So,
awesome.
I love him to death. So.
Yeah. It's a good thing he's so cute.
Yes. He keeps me on my toes. So I want to train him for the world.
Yeah. Yeah.
He does stress me out.
He's a sweet boy, but he's still so young too. I think is part of it. Yeah,
so.
He's just trouble. Yeah, I've lost several articles of clothing lately to McMurray. I don't know where he finds the stuff.
Yeah.
Even if it's put away or if it's behind locked doors, it doesn't matter.
Yeah.
He finds stuff and then he shreds it. So that's fun. Yeah. He's been chewing up my rug recently, so that's fun.
He does that to me too. So he's in the back barking right now. I don't know if you can hear him or not.
He's excited about getting his nails done today.
So,
yeah.
Yeah. I started taking him for jogs though. So that really gets some energy out of
Yeah,
him. It's
that's
great
good.
with the weather getting nicer.
Yeah, that can help a lot too with a lot of the destructive behaviors. And that
Yes.
sometimes just getting them some exercise
Mhm.
so they expend that energy doing something that they're supposed to do instead of
Yes.
things they're not supposed to do.
Yes.
You know, it definitely, and now that the weather's nicer,
Mhm.
we can actually do those
Yes.
things versus when they're cooped up in the cold and the
Yes.
snow. Yeah, it's just, it's an icky time of the year. And so
Yes.
they're so much more prone to
Mhm.
getting into trouble.
Mhm.
Yeah.
Oh, yeah.
So what questions do you have? Anything?
Questions do I have?
Yeah,
Just
I know I didn't prepare you at all for any of
No.
this. I never do. I'm like, we're doing a live video, guys.
What is your favorite part about being a veterinarian?
Oh, you know, my favorite part, I think, I agree. I think it's the clients. You know, obviously we all love animals so much. We're obsessed with them, but, you know, working with those clients to, you know, help them keep their pet healthy for as long as possible, addressing problems, you know, helping them with their fears and that, I think that's my favorite part.
Yes.
Yeah. Is being able to help them out when they're scared and they're nervous, they don't know what's going on, being able to communicate with them, and helping them through that, I think is my favorite thing.
Nice.
Yeah.
Nice.
I also love surgery. I think surgery is fun. It's one of my favorite things. Yeah.
I like surgery.
Yeah.
It's just monitoring anesthesia that can be a little scary.
It's nerve-wracking.
So it is.
Yeah.
It's very nerve-wracking.
Yeah. Yeah.
So it's just something you need to get used to.
Yeah. So it's good to have backup
Yes.
until you're confident.
Yes.
Yeah, for
Definitely.
sure. Yep. So,
Awesome.
all right.
Yeah.
Well, I think that's all that we
Okay.
have for today. Today was a short one. We went way long last time. But if you think of any questions or anything that you want to ask us, go ahead and post them in the comments, and we'll see about addressing it next week when we're live again.
Or if you need a pet sitter.
Or if you need a pet sitter.
Let me know.
That's a classic JB face. I love it. Have a good day, guys.
Bye, guys.